Hello everyone. Hi, my name is Abhishek Thakkar. I am from BU School of Public Health, where I am doing my Masters of Public Health with a concentration in healthcare management and global health. In this video, I will be talking about how I will approach on the quality improvement consulting assignment that was given to us after our second phase of interviews, uh, and I will present how will I approach the issue. But before we start talking about the consulting project, I would like to go thank you all for inviting me to this presentation. And I hope this video will be useful to you in terms of deciding which candidate to choose from. Now let's talk about the consulting assignment and the issue at your facility. Now, if we look at the process flow that you have presented in your assignment, we can see that it takes almost 4.5 hours for each patient to pass through the clinic, which is a very long time. And if you consider, let's say, 50 patients a day as a flow in the clinic, basically you are wasting 200 hours of patient time uh, by just putting them in a line. Now, there could be two reasons for this long wait time. First of all, lack of capacity, which means that you don't have enough staff members to serve your patients. It could be due to two reasons. One, you have more patients visiting you than normal workload, or two, you don't have enough staff, or the staff members are not available when they are needed the most. And the second reason could be that you have a lot of steps in your process. So basically, patients need to go through multiple stakeholders, meet multiple people, which can create confusion, and patients have to wait for a long time. But I think this can be solved through lean management and quality improvement tools where you can reduce the steps which are creating waste in the process. But before we apply quality improvement principles to improve the process, we need certain other data points, such as how many patients are coming each day, what is the variability in the patient demand. For example, are there more patients coming on Monday and less on Tuesday? We need to understand that patient flow. The other thing which we need is what capacity do you have, both in terms of human resources and finances. How many staffs can you hire if you need to hire more people? Uh, if do you have that financial capability, and in terms of HR, do you have staff members who are willing to come at a different time frame than the others? But before we can do that, we need to collect some data, do some analysis, and then come up with some recommendations. In terms of deliverables, if I am selected for this position, I would like to do a time series analysis for the clinic. A time series analysis is basically an analysis in which you look at the time difference between the wait times. It can depend on number of patients or the capacity, but there are certain days of the week or certain times of the day where the patient flow is high and certain days where patient flow is low. How this can be useful is that you can understand the demand, and basically if you have the capacity but then you are not utilizing your doctor's schedule very well, you can optimize the process by aligning your capacity with the demand. In addition to this time series analysis, I would also like to do some interviews, which is a qualitative way of looking at data. I would like to come in the clinic and meet the staff members who are a part of this process and understand how they feel about the process, if they have any suggestions to improve the process, and we can consider that process based on how influential their point of view can be or how important are they in the process. Now, after we finish that data collection part, we can then analyze the data and come up with some recommendations to reduce the waste from the process. Now, in terms of implementation, uh, quality improvement is always a cyclical process. So when you are recommending something, you don't know whether it will work perfectly well with the organization or not. So I would suggest that we should go ahead with a PDSA cycle, which is plan, do, study, act cycle. So you plan for the recommendations, you act on your recommendations, then you analyze whether the recommendations worked well or not. So you basically go back and do one more process flow and analyze everything one more time. And if you find certain loopholes where you can improve, you can apply that thing to your already implemented recommendations. That improves the process one more time, and then you go back to acting on that recommendations and then go ahead with one more study. Now, if we go through this process of collecting data, analyzing data, and then coming up with recommendations through PDSA cycle, we can certainly improve the process. However, we should keep in our mind that there might be certain barriers which can hamper the process of quality improvement in your center, which can include financial barriers and barriers in terms of change management. Uh, Let me explain what financial barriers mean. Financial barriers can mean lack of financial capacity for the clinic to hire new staff or implement the recommended quality improvement plan. And barriers from change management can include non-inclusion of certain staff members. Basically, you are not including all the staff members in the process improvement, and that can make certain people unhappy. But we can overcome through this issue by using Kotter's change model, which is a 8-step process to include everyone in the process of change. And that's it from my side today. I'm so sorry for the bad quality of this camera. I'm currently using my web camera. I'm traveling to Toronto and I'm in my hotel's game room right now. So I'm so sorry for that, but thank you very much for considering my application, and I'm looking forward to your answer. And hopefully I get to work on this consulting project. I'm really excited for it. Thank you.